Doxycycline is an antibiotic used in the treatment of infections caused by bacteria and certain parasites. The doxycycline is the tetracycline antibiotics group. Medical uses of doxycycline. Doxycycline is frequently used to treat Lyme disease, chronic prostatitis, sinusitis, pelvic inflammatory disease, acne, rosacea, and rickettsial infections. First-line treatment for chlamydia and non-gonococcal urethritis, and with syphilis for uncomplicated gonorrhea. Side effects of doxycycline antibiotics. Common side effects include diarrhea, nausea, vomiting, and an increased risk of sunburn. There have been concerns in the first trimester of pregnancy or in young children may result in permanent discoloration of the teeth, though in children this does not occur with normal doses. Daily dose of doxycycline antibiotics. The defined daily dose is 100 mg by mouth or by injection. The typical dose in adults is 100 mg once to twice per day for 5 to 14 days, though certain conditions may require longer courses of treatment. In children, the dose is typically 1 to 2 mg per kilogram twice per day. In those under 8 years old, less than 21 days are recommended, due to potential effects on the teeth. Note: for malaria prevention in those who weigh less than 40 kilograms, the dose is 50 mg once per day, while in those who weigh more than 50 kilograms, the dose is 100 mg once per day. Contraindications of doxycycline. Have ever had an allergic reaction to doxycycline or any other medicine. Have kidney or liver problems. Have an inflamed food pipe esophagitis. Have lupus, an autoimmune disease. Have myasthenia gravis, a condition that causes severe muscle weakness. Are pregnant or breastfeeding. Pregnancy and breastfeeding. Use of doxycycline antibiotics in pregnancy and breastfeeding. Doxycycline is categorized by the FDA as a Class D drug in pregnancy. Doxycycline crosses into breast milk. Other tetracycline antibiotics are contraindicated in pregnancy and up to 8 years of age due to the potential for disrupting bone and tooth development.